Good afternoon, and welcome to TMLT's new webinar series on HIPAA compliance, cyber risks, and cybersecurity. We appreciate you taking a little time out of your busy day to join us this afternoon, and we especially thank you for joining our initial presentation. The information that we'll be presenting today is strictly informational and the opinions of the presenters. It is not to be considered legal services or legal advice. I am Cathy Bryant. I am the manager of TMLT's product development and consulting services. Among the various things that I do at TMLT, I work with physicians and their practices every day to help them with HIPAA compliance. Everything from risk assessments to mitigating issues identified in those risk assessments, and a variety of other topics that we'll be discussing throughout the program. My co-presenter for today is Kassie Toerner.
Good afternoon, everyone. I'm Kassie Toerner, not to be confused with Cathy, making it fun for you today. And I am a Senior Risk Management Representative here at TMLT. And I also work with Cathy in the Product Development Department doing HIPAA compliance and risk assessments with our policyholders and other healthcare providers as well.
So, Kassie, I know you attended a conference earlier this spring and heard senior officials from the Office of Civil Rights, which of course are the enforcers of HIPAA, or as I lovingly like to refer to them as the HIPAA police, speak. And I wondered what you had heard that might answer our question of the day. Is HIPAA relevant in
Well, Cathy, I'd have to say
2019?
a resounding yes to that question. It's interesting that many experts thought that there would be less HIPAA enforcement in 2018. However, the OCR, the HIPAA police, as you affectionately named them, concluded 2018 with an all-time record high for HIPAA enforcement, um, not only in penalties but also in investigations that they conducted. There is no slowdown in their enforcement activities. The leadership continues to have a strong commitment to protecting patient data, and again, their robust enforcement efforts continue. We are seeing a significant focus on individual rights to access their medical records, and making their data more useful and transferable is a common theme that we see. With regard to the enforcement activities, the majority of these activities involved entities that fail to conduct a thorough overview and assessment of potential security risk and vulnerabilities, such as their risk assessment. Another common enforcement action that was covered this past year were pertaining to written business associate agreements with contractors and others entities prior to transmitting PHI. So covered entities and healthcare providers need to be very proactive about data security, as we do see that HIPAA is very relevant in 2018 and 2019.
You know, Cassie, often when I think about HIPAA, I think about HIPAA as sort of being off on an island all by itself. But in reality, it has to be integrated into everything that a practice does. Because today, what can a medical practice do that does not involve protected health information? We often discuss HIPAA compliance as being a journey and not a destination. The challenge for practices is to navigate their way on the journey. So often, other regulatory compliance ends up being placed on the back burner of admins or others um, responsible for compliance in the practice as they deal with day-to-day regular requirements and the things like getting billing out and practices paid. If you look at the roadmap that we've designed for HIPAA and more, you'll see that, of course, we're going to start with HIPAA. HIPAA has been a federal law in place since 2003. The first rule that went into effect was the privacy rule. But HIPAA is not stagnant. There have been other laws that have come into play, like the security rule and the breach notification rules, that we'll talk about a little more in future slides. There's also the Texas privacy laws. Texas has some very unique laws, but other states are forming other unique rules and regulations as well. The Texas, in addition to Texas privacy rules, the federal regulations as more and more different kinds of connected devices come into play. Cybersecurity is a is something that needs to occur frequently for the practices uh, because the cyber criminals work 24 hours a day, 7 days a week, trying to trick people into giving up passwords and various methods in order to try to uh, gain access to a practice's protected health information. The Health and Human Services and Office for Civil Rights, like Cassie said earlier, is constantly providing updates on interpretations as well as enforcement actions that are providing a roadmap for compliance. Your cyber insurance. Do you have it? Do you need more? And last but not least is the Texas Medical Board. We're seeing more and more cases where patients are filing complaints against physicians for either breaches or other cybersecurity incidents where they believe the practice has not protected their information. Just last week, one of our cyber attorney friends shared with me that they had had an informal settlement conference with the Texas Medical Board about a complaint of loss of records due to a data loss event. Ultimately, the panel dismissed the complaint because they cited that there had been no prior board actions against the complainant, and the practice had aggressively tried to mitigate the harm and spent significant money and remediation on the actual to help mitigate the issues after the event. They'd even offered free patient visits and had done a great deal of work on upgrading their IT systems. Everyone has a different definition of HIPAA compliance. As I stated earlier, HIPAA has three rules: the privacy rule, the security rule, and the breach notification rule. HIPAA has evolved. It was not designed as a once and done kind of topic. There are new rules that have come out, like the breach notification rule. New interpretations come out frequently from the Office of Civil Rights, as well as guidance that can be gleaned through enforcement. So, have you ever asked people in your practice, What does HIPAA mean to the practice? Have you asked the receptionist? What does it mean to them? Or how do they think it relates to the practice? And is this the same thing as what the physicians think, for instance? This is a good discussion topic for practices to consider when you're doing different kinds of staff meetings or HIPAA trainings.
The former director of the Office of Civil Rights, Jocelyn Samuels, said there are several critical issues covered entities should be doing to show compliance with HIPAA, privacy, security, and the breach notification rules that Cathy has mentioned. She said it's critical that entities take a comprehensive and thorough approach to assessing and addressing the risk to all of the protected health information they maintain. She also says that you must have a comprehensive policy and procedures for compliance with the HIPAA rules, but also the policies and procedures must be clearly communicated and implemented to all workforce members. So with the HIPAA risk assessments, this is the leading cause of OCR financial settlements and penalties, and not all risk assessments are created equally, but the HHS and OCR suggest that the organization should at least identify where PHI is stored, received, maintained, and/or transmitted. They also recommend that you should identify potential threats and vulnerabilities. These could be malicious threats, inadvertent threats from within your organization, also things like natural threats, floods, earthquakes, environmental factors. They also recommend assessing your current security measures that you're using to safeguard your PHI. They say to determine the likelihood of a reasonably anticipated threat. They also say to determine the potential impact of a breach of PHI and assess the levels for vulnerability and impact combinations. And as with everything in healthcare, they say document, document, document. So anything that you do to address your risk assessment or your vulnerabilities and threats that have been identified, we recommend that you log those, keep your email reminders, keep meeting minutes if you're addressing a security issue or a HIPAA privacy issues, screenshots, audit reports that you're doing. Any of those things can be helpful to you to show your efforts and the reasonable efforts that you're making to minimize cyber threats within your organization. Also, next month, our webinar will focus specifically on conducting a risk assessment. In your risk management plan, this will help you to prioritize your weaknesses and vulnerabilities as you have identified them from your risk assessment. And again, policies and procedures, as Jocelyn Samuel says, you must have to meet the expectations of the OCR, have policies and procedures in place. The OCR would like to see that these are detailed and specifically reflect how your practice is safeguarding protected health information. On occasion, we see copies of policies and procedures that were perhaps shared from one covered entity to another, or we see generic templates. And back in time, that may have been sufficient, but now we see that the OCR really wants to see specific details of how you are addressing each of the rules that Cathy mentioned, the privacy rule, the security rule, and the breach notification rule. So for privacy, for example, do you have a notice of patient privacy that has been updated since 2013? Some of the questions that you would want to ask are, how can individuals access their medical records? Do you provide confidential communications if the patient requested? Do you handle patient complaints? How do you handle those if they have a privacy complaint? Do you have a privacy officer? Do they have a job description or functions? Do you have a procedure for patients to amend their medical record? Those are just some snippets of what the privacy rules would want you to address. With security rules, they would like for you to look at, do you have physical safeguards such as locks, alarms, security cameras? Do you have a contingency plan? Do you have audit controls in place? What do your workstation security, what does it entail? Are patches being completed? Are employees allowed to bring their own personal devices to access ePHI? And are those devices encrypted? So just some things there to think about for privacy when you're developing your policies and procedures. And then breach, what is your notification to patients? What is your notification to the media? What is the notification to the OCR and HHS? All of those are things that you will want to have detailed out, who is responsible, timelines, and what have you. Again, it's a very robust policy and procedure manual that they're looking for, but that's what they're looking for to meet the expectations of the OCR. Also, customized training and webinars and education are critical at this point. We know now that well over half of breaches today are from a workforce employee. Many human errors can be prevented by making sure that your employees know their basic data security measures. Many experts now are saying that employee training is needed to address the human firewall issue, given that the majority of the breaches that we see do come from an employee. And I think, Kathy, you have a polling question for us at this time.
Yes. So we thought we'd ask, just to give you a little chance to participate, how many HIPAA policies and procedures do you have in your practice? If you just type a number in the type your answer here line and then hit the little gray icon to the right, we should start seeing uh, evidence or numbers that come up. I think someone typed in, will you have PowerPoint slides to send us? Yes, we will send you both the PowerPoint slides and a link to the recorded webinar following the presentation. Give it just another couple of seconds for people to answer the polling question. Looks like 60. That's a pretty good answer, because if you look at the HIPAA privacy or the HIPAA audit protocol, which was published in 2016, you actually will find that the OCR asks for evidence of written policies and procedures about 100 times in that protocol. And so it's pretty clear that they are asking for more than, a 5 or 10 page HIPAA manual that we see in some practices. Cassie talked about 2018 being a major year for enforcement. In fact, we had gone about 18 months in between the last time we saw a medical practice be fined for a HIPAA violation until late 2018. I'm going to look at a couple of recent enforcement actions that have actually taken place against medical facilities in the last month or so. The first one is Tennessee Diagnostic Imaging. They had a very interesting way that they found out about their own cyber incident. In May of 2014, they received a call from the FBI notifying the practice, and oh, by the way, the OCR as well, that one of their servers had allowed uncontrolled access to PHI. The FBI and other federal agencies actively monitor the dark web where the cyber criminals live and work for evidence of protected health information. And when they can trace it back to a particular practice or a facility, they notify the facility. In this case, the covered entity did their investigation and initially claimed that no patient protected health information had been exposed. However, during the Office of Civil Rights investigation, the covered entity had to admit that in fact protected health information of more than 300,000 patients was exposed. Because of their attempt to deny that evident or that PHI had been exposed, it resulted in untimely delay in notifying the patients. The OCR found, besides the untimely delay in notifying the patients, the practice had failed to conduct an accurate and thorough risk analysis, which is often in today's language called a risk assessment. The practice had also failed to have business associate agreements in place with its vendors, including their IT support vendor and a third party data center, which is required by HIPAA. As a result, the practice paid a $3 million fine to settle the breach with the OCR.
Another recent enforcement action was from Indiana. A medical record service software company, Medical Informatics, provides services to healthcare providers. And a breach report was filed with the OCR discovering that hackers used a compromised user ID and password to access the electronic protected health information of approximately 3.5 million people. OCR's investigation revealed that medical informatics engineering also, as with the previous case study, did not conduct a comprehensive risk analysis prior to the breach. The HIPAA rule requires, as we've said, a accurate and thorough assessment of potential risk and vulnerabilities to the confidentiality, integrity, and availability of an entity's electronic protected health information. The OCR director, Roger Saravino, said entities entrusted with medical records must be on guard against hackers. So, in addition to the $100,000 settlement, Medical Informatics Engineering will undertake a corrective action plan to comply with all the HIPAA rules, and they must also complete an enterprise-wide risk analysis or risk assessment as well. Earlier, we mentioned that the OCR's enforcements for 2018 were very robust. Here's a little graph that breaks down their investigations. There were a little over 1,600 investigations in 2018 into potential HIPAA violations. You can see that there were 10 settlements in 2018. Those 10 settlements totaled a little over $28 million for 2018, which was a 22% increase from the previous year. One of the larger breaches that contributed to that, the largest breach of U.S. healthcare data in history, was the Anthem breach that cost Anthem $16 million. Some of you may have heard of this breach before, given it was very public and, like I said, the largest breach in U.S. history in a healthcare organization. This breach was interesting because it basically started from cyber attackers using a spear phishing email that was sent to an Anthem subsidiary, and after at least one employee responded to this malicious email, and that opened up the door for Anthem to be under attack further because of this email that was malicious that was sent to an employee. Hence, again, the importance of employee training and looking out for those types of malicious emails. This breach, 79 million individuals were compromised as a result.
If you take a look at the summary of the last 4 years of OCR settlement investigation or breach investigations, it's interesting to note that in 2018, 359 breach investigations ended up with corrective action. This is a much larger number than we've seen in the previous years, and we anticipate that this will continue to grow. When we talk to cybersecurity professionals, they all agree the greatest vulnerability and the weakest link in any computer system is the user. This means even well-meaning employees can be a huge risk to your practice. And as Cassie has pointed out, educating in an ongoing way of your employees is one of the most essential things you can do. These are some basic tips on healthcare cybersecurity. Establishing that security culture is very important. Physicians and leaders in the organization must create that culture. If physicians are sharing their passwords with the MAs so the MAs can log them in when they come into the exam room, that's really not setting a real good example of security. So everyone must do their part. Protecting mobile devices. That includes laptops, tablets, phones, backup devices, USB drives. All of those things are considerable risks to the practice um, if they are not encrypted. Encryption is considered a basic cybersecurity measure today. And if you allow PHI on mobile devices, those devices should all be encrypted. In fact, a few years ago, there was a small practice, I think it was 11 physicians, who an employee had a portable device stolen out of their vehicle while they stopped for lunch. And on that unencrypted device was protected health information. Ultimately, the practice was fined $750,000 for this breach because they had failed to protect that, that device. You need to maintain good computer habits. These include things like when employees walk away from their computer, do they lock the screen or do a Windows L or some other shortcut to make the computer go to sleep so people walking by their computer can't see PHI? Do you have a firewall? Are the settings correct? Have you installed and maintained antivirus software? You need to plan for the unexpected. One of the most devastating things that practices are experiencing is ransom attacks, where literally they come in the morning or they return from lunch and the practice cannot access their records. Are you ready for that eventuality? Do your employees know what to do if they get that pop-up message that your files have been encrypted and you need to pay a ransom in order to regain access? Can your practice continue to see patients if you cannot access your records? Do you have forms ready to go to revert back to paper? What if it's a matter of a power failure? Can you see patients? Or do you have to end up canceling patients for the day? You need to control access to protected health information, whether that is by limiting access within the system or the network, or whether or not you need to uh, limit access at the specific software. If your receptionist only needs access to the scheduling modules in your EHR, then they should not have full access. Can't say enough about strong passwords. The Indiana practice that Cassie discussed, the recent enforcement, their whole issue started with an inadequate password. You need to limit network access and control physical access as well. That's to your building, to your office, and to your actual network. And especially if you have a server room, you need to limit access to that as well. So I have one more polling question before we conclude today's webinar. On a scale of 1 to 10, if you received a notice that your practice was being investigated by the OCR for a complaint investigation, how prepared would you be? Give you a couple of minutes if you just click on the number, and then you should be able to cast your vote. Give you a couple more seconds, and we're getting kind of a wide range from 3s to 8s. Well, thank you for sharing your readiness votes at this time. If you have questions, you can use those, you can populate those in the question and answer pod. Um, and if you are, if you do not have any other questions at this time, like I said, we will be sending out the um, the presentation as well as a link to the recorded webinar following the presentation. I'm going to go ahead and enable microphones in case anyone wants to ask a question. Cassie, do you have any closing remarks you want to make?
No, the final remark, if you do have a question that comes to mind, please feel free to email that question to consulting@tmlt.org. And as Kathy said, you'll also get a link for today. But again, if you have any questions, please feel free to email us. And if we can be a resource to you, we'd be happy to do that. We definitely thank you for your participation today.
Thanks, everyone.
Thank you.